Good afternoon, everyone. My topic was on micro or minimally invasive glaucoma surgery. So it's an ab internal micro-incisional approach, and it's a minimally traumatic to the target tissue with a negligible disruption of normal anatomy and physiology, which is there is a modest efficacy will be there and a high safety profile will be there, and there will be a rapid recovery with minimal impact on the patient's quality of life also. So what fits for our patient will be the choice for a given surgery will be influenced by patient's prior surgical experience and trust in the surgeon, surgeon's experience and success with certain procedures and techniques that lead to the safety and success. So mainly this MIGS will be useful for the open angle surgeries than the closed angles. So trabecular outflow surgery it can be in the trabeculectomy by internal approach like trabectomy you are using the GATT, and by using the trabecular micro bypass by stents like eye stent and Xen gel stent you can be using. So mainly coming to the trabectome, it's an electrocautery device using the internal approach. It ablates the section of trabecular meshwork, unroofing the Schlemm's canal and collector channels. But the main advantages with this of trabectome will be it opens a continuous pathway from anterior chamber to Schlemm's canal. No conjunctival scarring will be there, but disadvantages will be cleft may close with forming the PAS, and access to Schlemm's canal circumferential is limited. And when coming to the GAT, favorable results will be can be seen in the pigmentary pseudoexfoliation glaucomas or failed GDDs and steroid-induced glaucomas or angle restriction also sometimes, but it was contraindicated if there is any peripheral anterior synechias or aberrant angle vessels. But the complications from the GAT will be the hyphema, cyclodialysis and iododialysis, but recovery is seen in mostly 90 to 95% of patients within 1 month time also. And when coming to the excimer laser trabeculotomy, it's energy of the xenon chloride pulsed excimer laser connected to the quartz fiber optic probe. This procedure intends to enhance outflow facility by creating a micro perforations in the trabecular meshwork and inner wall of the Schlemm's canal. So 8 to 10 laser punctures are spaced over 90 degrees, and each pulse delivering a mean energy of 1.2 millijoules over 80 nanoseconds duration. So coming to the eye stent, it was approved and used in a combination with the cataract surgery also for mild to moderate open angle glaucoma surgeries, and the ideal candidate should be stable and well controlled disease to reduce dependence on the topical medications. It's a 1 mm into 0.3 mm only, and weights is just a 60 microgram, and heparin coated also to prevent fibrosis and blockage. And the main mechanism is designed to improve the aqueous outflow through the natural physiological pathway, and it creates a bypass through the trabecular meshwork to the Schlemm's canal. And CyPass is a suprachoroidal shunt. It's a 6.35 millimeter long and had a single lumen of about 300 mm. And aqueous can enter the distal lumen residing into the anterior chamber and pass into the suprachoroidal space through the multiple fenestrations along the length of the implant. And obstruction and encapsulation are the possible sources of the failure of the CyPass. And what are the IOP goals? Actually, patients with target IOP goals of low teens might be able to get this goal with MIGS and medications, and glaucoma suspects and early open angle glaucoma patients that will rapidly progress, but who also have a cataract can be considered for phaco alone or phaco with MIGS. So in a study by the Philip et al., if we give a patient early enough, a MIGS helps to prevent being on too many drops or to even avoid starting the drops also. So for more severe cases of glaucoma, MIGS does not routinely get eye pressures into the low teens, and in those patients, patient need pressures in low teens to high single digits of glaucoma progression to halt. This MIGS will be helpful. So what after the MIGS? So paradox was there to prolong attempt at a medical control in these eyes because they were thought to have a lower risk of visual field deterioration. If you put off necessary surgery, patients get worse. So MIGS can definitely fill a role in the early stages of diseases for controlling the pressures. And a patient controlled for 5 years with MIGS procedures who then goes on to receive a trabeculectomy can probably get through her lifetime without significant vision loss, and options are more limited if trabeculectomy is done earlier. And some complications are there which include the bleeding in the eye, temporary complications like IOP rise or corneal swelling, visual disturbances may also be there as a complications. And coming to the conclusion, the advent of MIGS has allowed for improvement management of patients with mild to moderate glaucoma. As surgeon experience expands and number of MIGS approach grows, these procedures may even be utilized in more severe cases and across a wide range of clinical scenarios. And the field of MIGS has expanded rapidly in the last decade, adding to the glaucoma surgeons' armamentarium and their ability to tailor surgical procedures to each specific patient. Future devices and surgical approaches will continue to be developed in the coming years. Thank you.
Thank you.
Thank you, Judge. Thank you, everyone.
Thank you very much.